5-Minute Pearls for Clinical Practice. This week's Pearl is How to Pick Your Profession, Part 1. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. And each podcast episode is about 5 minutes. I remember back in medical school, one of the attending doctors at Johns Hopkins asked me what area of medicine that I wanted to go into. Would I want to go into a surgical specialty? Would I want to go into a medical specialty? Dermatology, cardiology, radiology, gastroenterology? He wanted to know. I said that I wasn't quite sure yet, that although I was interested in many specialties of medicine and even some in surgery and some of the imaging specialties, I wanted more time to think about it. I remember hearing a lecture many years ago by Stephen Covey, where he talked about making sure that you choose the right ladder to climb before you start climbing. He wisely said that it is a lot easier to choose the correct ladder from the beginning than climb down the ladder that you're currently on and start climbing up a new ladder. Let's say you decide to be a cardiologist. Well, then you do a general medicine residency and then a cardiology fellowship. Well, if you become a cardiologist and you start practicing cardiology, and then 10 or 15 years down the road, you realize that cardiology is just not for you, that instead you want to be a colorectal surgeon. Well, all those years of training in cardiology pretty much go out the window, and you need to go back and start at the bottom of the ladder with a surgical residency and then subspecialty training to become a colorectal surgeon. So it's best to take your time, choose your career and the ladder very carefully, and then steadily climb that ladder over time. But how do you pick your ladder? How do you determine which ladder to climb? In my medical training, no one ever reviewed this with me. Sure, I talked to lots of physicians, I talked to healthcare providers, I talked to a lot of people in my medical school, but no one sat me down and reviewed the principles for choosing a career path. So I thought I would take a couple of podcast episodes to review the principles that I found important to finding an optimal career path in the health sciences. I've come up with 4 principles. 4 questions to ask yourself to determine if a specialty is right for you. And this applies to medicine or surgery or the imaging sciences or nursing or just about any other area that involves taking care of patients. Let's get started. The first question to think about is, what are you passionate about? Not just what do you find interesting, but is there something that you truly love to do, even if you weren't getting paid to do it? What are you passionate about? Is there something that you would love to read about in your spare time? Is this something that you truly love to talk about and think about? What do you truly love to read about? Most healthcare careers last about 40 years or so, and that's a long time. Can you spend the next 40 years practicing the specialty that you're considering? Can you think about the heart for 40 years? Can you think about surgery for 40 years? Can you think about the stomach for 40 years? Can you think about the knee for 40 years, day in and day out? Can you think about allergies? Can you think about cancer? Do you think about lung disease? What do you find truly interesting? Clinical practice can get a bit monotonous over time. I'm sorry to break that to you. Dealing with the same issues over and over again can get monotonous. If you don't truly love what you're doing, it will become very difficult to practice whatever you end up practicing. Find passion and inspiration in what you're doing, or you will quickly burn out and become bored. So think about where you find passion. Think about what gets you really inspired. Be careful not to go into a specialty simply because you met someone who got you excited about a certain specialty. Make sure that you truly find something that's fascinating and not base your decisions solely based on the people that you encountered in a certain specialty. For me, my passion is general medicine. I truly love general internal medicine. I really enjoy helping people navigate the healthcare system. I love quarterbacking medical care. I truly love it. And when I decided to become a general internist back in the 1990s, it was something that interested me back then, and fortunately, I still love it now. What area of healthcare inspires you? What can you see yourself doing 20, 30, 40 years from now? Take your time, think about the different specialties, and think about what truly inspires you. So the first question to ask is, what inspires you? Number 2, the second principle to look at, and this is a tough one as we need to take an honest look at ourselves. We may be passionate about something, but are we really good at it? Are we interested in something, but maybe it doesn't quite fit our skill set? The goal in trying to find a profession is to find something that we truly enjoy doing and that we're good at. Think about your skill set. Are you good with people? Or are you good perhaps with your hands? Or are you really good at looking at things and trying to come up with patterns? Do you have a great ability to perform procedures? Do you like to build things? Do you have tremendous focus and attention? Think through your skill set. Think about what others have said about your skills. And then as you encounter people in various specialties, take note of the skills important to that specialty. And then see if your skills match up with the skills necessary to be truly exceptional at that specialty. One thing that I like to have students do is draw 2 circles. The first circle encompasses your passions, the areas in healthcare that you truly enjoy and are inspired to think about. That's the first circle. The second circle are your skills, the areas in healthcare where you're truly skilled. Draw these 2 circles next to each other and then have the 2 circles intersect, overlap. And then find the areas in medicine or surgery or other places in healthcare where these 2 circles intersect, the circle for passion and the circle for skills. Make sure that the specialties that you're looking at are areas that you truly enjoy and which fit your natural skill set. Now, next week, we will review the 3rd and 4th principles important in choosing a long-term career in healthcare. Until then, think about what I've just reviewed. Think about the 1st and the 2nd principles. Think about your passions. Think about your interests. And then think about your talents, both your natural talents and also your talents that you've developed over the years. Think about where you can see yourself in 20, 30, or 40 years. I'll see you then, and until then, think about what we've talked about in this episode. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. You can post your comments and your experiences on the 5 Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD. And you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you are subscribed on iTunes, you will receive new podcast pearls as soon as they are posted. And if you have a few minutes and you enjoy what we're doing here on this podcast, please head over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.